Okay, here we go. All right. So the term hyperlipidemia refers to having high cholesterol. So we're going to talk about what is high cholesterol, what is cholesterol in general. The two major components of cholesterol are our LDL and our HDL, and we'll discuss that. We'll discuss how high blood fat or high cholesterol is diagnosed. We'll talk about the appropriate cholesterol ranges, causes of hyperlipidemia or high cholesterol, how to prevent and control high cholesterol. And that's done through the topics of healthy eating habits, lifestyle changes, exercise and activity, medications, and of course, follow up with our primary care physicians. So we'll go ahead and begin the conversation. And the first thing we're going to talk about is what is high cholesterol. So hyperlipidemia itself is better known as high cholesterol. That means there's too much of the bad cholesterol or the LDL in your blood. This condition increases the fatty deposits that collect in the blood vessels. And as that fatty deposit continues, it narrows the blood vessel, preventing appropriate flow of healthy blood and can lead to a complete blockage. And of course, that complete blockage can be very critical. So cholesterol is a form of fat. That cholesterol is actually produced in the liver, and our liver produces all of the cholesterol that our body needs. The rest of the cholesterol that we take in the body comes in from animal fat. So what we produce naturally travels into our blood, helps to produce hormones, transport vitamins, and helps with our digestion and the breakdown of our nutrients. The excessive amount of cholesterol is what causes us problems. So when we look at the two major forms of cholesterol, the LDL, or our low density lipoprotein, is the bad cholesterol. When I was in school, I always had problems trying to determine, okay, which one was the bad and which one was the good. And I learned from a fellow student the best way to remember is LDL basically is our lousy cholesterol, and our HDL is our happy cholesterol. So we know that our LDL or our low density lipoproteins are the bad cholesterol. And this is what forms and builds up in the arteries, preventing that optimal blood flow to the heart and to the rest of the body. And our HDL are our high density lipoproteins, which is our good or our happy cholesterol, is what transport that cholesterol from the body parts back to the liver, where it can be discarded from the body. So the HDL and LDL actually work like a seesaw. The higher the LDL, or the higher the bad cholesterol, the lower the HDL, or the lower the good cholesterol. And the higher the good cholesterol, the lower the bad cholesterol. So when we think of that, again, think of the seesaw. One goes up as the other goes down. So how do I know if I have high cholesterol? Well, hyperlipidemia or high cholesterol really doesn't have any symptoms that you can detect. There's no change in the way you feel. There's no discoloration of the skin. There's no itching. So there's only one way to detect if you have high cholesterol, and that's through a blood test called a lipid panel or a lipid profile. And this test helps you to determine what your cholesterol levels are. And what we look at is our HDL, our LDL, and we look at our triglycerides. And what we're looking at too is our cholesterol ratio for our HDL. And so in looking at the slide that you have in front of you, diagnosis is typically based on the medical history, the patient's physical exam, blood tests that are done from fasting, because we don't want to take that blood test right after you've eaten because again, you're digesting fats. And so that can alter that level. But as you can see here, appropriate levels for each of those are as follows. We want the cholesterol, the overall or total cholesterol, to be less than 200. We want your triglycerides less than 150. A good HDL is 60 or higher, and a LDL of 60 to 130 is best. And we want that cholesterol to HDL ratio to be about 4%. So if it's beyond that, then you are considered either borderline or high risk. So a cholesterol of 200 to 239, which says you are at risk for hyperlipidemia. If the triglycerides are elevated between 150 and 199, you are at risk. Anything over 200 to 499 is high risk. One of the questions that was posed is, why is it my HDL can be good, my LDL can be good, and yet my provider is saying that my overall cholesterol isn't? We have to look at the triglycerides as well, because you can have a normal HDL and LDL level, but if the triglycerides are elevated, then that alters the total cholesterol levels. And so the triglyceride levels are important as well. And the triglycerides are another component of the fat that is traveling in the bloodstream. So these three elements determine the total cholesterol level. And this lipid panel is usually done, as I said, fasting. And those three components are what they're looking at. Really, the baseline is how much fat is floating in the bloodstream. So when we look at our cholesterol levels, I just gave you some of those ranges. Our total cholesterol, again, should be less than 200. They want the LDL less than 100. At an LDL of 100, that means we have a decrease in our HDL. And we want the HDL to be greater than 60. And so again, this is just another view of where we are in regards to how we are categorized based on those numbers from the labs. And it's important that you know what is desirable, what is considered borderline, and what is considered high cholesterol. So what causes high cholesterol? You know, a lot of people say, you know, I eat well, I exercise, but my cholesterol is still high. There are a lot of different factors that contribute to that. Your family history. Did you guys know that high cholesterol is hereditary? If your mom, your dad, aunts, uncles, cousins, grandma had high cholesterol levels, you could very well have inherited that gene, which makes it even more difficult for you to maintain good cholesterol levels. Your lifestyle, whether you're eating healthy, exercising, whether you're overweight or obese, whether you consume large amounts of alcohol, and or if you smoke, they all contribute to high cholesterol. Your age and your ethnicity. As we get older, of course, there are changes in the body to include hormone production. And the cholesterol that we do need helps to produce hormone. And if our normal hormone production, which aids in digestion, activity, cellular growth, starts to decrease, that means we have to work harder at keeping that cholesterol level stable. Your ethnicity plays a role. It is very common, especially here in the San Antonio area, for individuals of Hispanic ethnicity or Latino, as it may be called, or Latinx, and African Americans or Blacks traditionally inherit a gene that contributes to high cholesterol. So you're starting out with a gene. As you get older, you trigger that gene, and your diet and your activity levels are such that it contributes to that development of that fat in those arteries, then you end up with high cholesterol. Sometimes it can also be triggered by secondary causes which increase your cholesterol level. Some medications, some disease processes, some treatments can all contribute to elevations in the cholesterol. And those are things that we don't have control over. And the best thing that we can do for ourselves is to stay active, stay in communication with our primary care providers, and eat well. So again, causes of high cholesterol. Diet is one of the major contributors. An unhealthy diet can cause the cholesterol levels to elevate because most of the foods that we consume have some fat. Unfortunately, we are a society of individuals who live off of fast food, processed food, vending machine foods, and very little natural, organic, healthy foods. And processed foods, fast foods, contain the 3 ingredients that we, meaning Americans, adults, should avoid most. And that's salts, fats, and sugars. And so by having an unhealthy diet, we are contributing to that buildup of the fats in the body that are not soluble, meaning they are ingested, digested, and then stored in the body. The lack of physical activity or exercise can increase your level of cholesterol. That's defined as a sedentary lifestyle. Unfortunately, we as a country have developed habits that were different from generations back. People are working from home now. And so they have easy access to the refrigerator. They're not getting up and moving. They're sitting at their desk behind a computer all day. They're not getting the exercise or the activity that the body needs. And so again, we're not burning that fat, we're storing it. Healthy, regular exercise of about 60 minutes a day, at least 5 days a week, can help us in maintaining an active lifestyle. Obesity. People who are overweight are likely to have higher levels of LDL, or the bad cholesterol, and lower levels of the good cholesterol, or the HDL. Again, you're overweight because you're storing fat, and that storage of fat circulates in the bloodstream, causing that buildup in the arteries, which causes narrowing of those arteries. And alcohol consumption in excess can cause an increase in the cholesterol level. It's a little difficult to explain the chemical process behind the digestion of alcohol and the effects it has on our cholesterol. But what ends up happening is with alcohol consumption, it immediately causes a lowering of the body's blood sugar and then acts as rocket fuel, causing elevations in the blood sugar. And of course, those elevations in the blood sugar, if not removed by the body, is stored as fat. The sugars in the bloodstream that we don't burn stores as fat. And generally, the first place that it starts to store this fat is on the liver. And so alcohol consumption can play a very critical role in our cholesterol level. I've had people to say, I eat well, I exercise, and I have my 3 glasses of wine before I go to bed at night. What's the problem with my cholesterol? Maybe it's 3 glasses of wine at night. The alcohol is causing yo-yo effect in the blood sugar, which again causes you to store that sugar as fat. And that fat circulating in the bloodstream is cholesterol. So here are some other causes. Smoking. Acrolein is a chemical that's found in tobacco. HDL from transporting those fatty deposits to the narrow blood vessels and causing them to become even narrower. So what's happening is we don't have the transportation of the good cholesterol to move the bad cholesterol out of the bloodstream. And that acrolein is a disgusting yellowy substance that sticks to all of the interior of the arteries of the body. And so if you can imagine having a pipe, let's say, and we decide that we're going to stick chewing gum in that pipe. And then we're going to try and force a fluid through that pipe with that chewing gum in it. What happens? It blocks and it causes a narrowing. Plus, not only does it cause a narrowing, it also allows or exacerbates other things to stick to the interior of the arteries. We now have a sticky substance that can cause a blockage because calcium buildup, sugar buildup, fat buildup, vitamins and minerals that should be transported to specific parts of the body to be used as fuel and energy are now sticking to the walls of those arteries, causing them to be smaller. Smoking is probably one of the biggest precursors to having high cholesterol, along with, of course, heredity. Your age, the risk of narrowing arteries increases as we get older. And so that in itself contributes to high cholesterol because we are naturally having a constriction of those vessels. And then we add all of this fat, we add all of these other elements, and that further decreases the ability for healthy blood to flow through those arteries. We already talked about ethnicity, but what a lot of people don't know is that individuals from India, Pakistan, Sri Lanka, and Bangladesh have increased risk of high cholesterol as well. Other causes of high cholesterol can be underlying health conditions, such as diabetes, liver or kidney disease, polycystic ovarian syndrome. Other things like, believe it or not, pregnancy. Again, with pregnancy, you can have dilatation or constriction of blood vessels, depending on where they are. Underactive thyroid, drugs, all of these cause an increase in our LDL, which in turn causes a decrease in our HDL. So if you're an individual over the age of 50 and you are a specific ethnicity and smoke, are overweight, and don't exercise, you have a target on your back, and it's called high cholesterol. So management of cholesterol is very important. High cholesterol can be lowered by exercise. And we can lower the cholesterol by reducing our risk for heart attacks and strokes. Because remember, those blockages that occur due to those cholesterol levels or those fat deposits cause a narrowing of the blood vessels, which can lead to a complete blockage of the blood vessels. And that blockage of the blood vessel to the heart or to the brain result in heart attacks and strokes. In the medical field, we call the biggest risk for cardiovascular events the triple threat. The triple threat is known as high blood pressure, high blood sugar, and high blood fat or high cholesterol. The combination of those three are the #1 cause of cardiovascular events or heart attacks and strokes in the United States today. Often changing your behaviors go a long way with helping to keep your numbers in a healthy state. Lifestyle changes alone don't necessarily improve your cholesterol levels, though. Sometimes medication is needed to assist. So when we talk about the management, if you're diagnosed with high cholesterol, your overall health is affected, and it requires making some changes to eliminate some of those risk factors. One of the biggest is smoking and high blood pressure. I just told you the three major causes of cardiovascular events include blood pressure, blood sugar, and blood cholesterol. Losing excessive weight can help to improve your cholesterol levels. If you had a weight loss of about 10% of your body weight, that can help to lower your cholesterol numbers. Another one of the questions that was asked was, does it generally take a long time? That factor is dependent upon the individual. For most people, it does take a little while. And the reason being is, one, the body is conditioned, and that lack of activity changing to becoming active causes the body to want to store fat rather than burn it. It's kind of like if we are trying to survive and there is a push and a pull in the body. And the more you pull or the more you push, the more the body's going to pull back. And so as we begin exercising, as we begin our changes in our diet, the body is not accustomed to that. And so we tend to have a situation where the body's trying to hold on to that excessive fat. That's what our body is used to. That's the condition in which the body exists. And so those changes don't come rapidly. It takes a little while for that to occur. The American Heart Association also provides some additional information that is very, very helpful. And if you can see on the slide, we've given you the link to the YouTube that talks about management of cholesterol. So, high cholesterol and blood pressure, is there a direct correlation between the two? And I think you probably already know the answer to that because we've talked about the triple threat. So that correlation does exist.
We have questions.
Okay.
That's why.
Good. Do I need to stop and answer some of those now?
One of them does a hysterectomy make the chances of an increase in bad cholesterol?
The question was, does a hysterectomy I'm sorry.
Increase your chances of high
Oh, does a
cholesterol?
hysterectomy increase your chances of having high cholesterol? A hysterectomy in itself does not increase your risk. What increases the risk is the change in metabolism after a hysterectomy. You have the lack of progesterone and estrogen production. And that lack of those hormones can cause the body to store fat more readily. And so it's the level of exercise and diet that really contribute to what's going on with the cholesterol level. So I hope I've answered your question. Just having the hysterectomy itself does not increase your risk.
One of the other questions is, does anyone ever go off the medication once they're on it?
Does anyone ever come off a cholesterol medication once they're on it? Yes. A good number of individuals who are on cholesterol medications have come off of their medications with, again, weight loss, diet, and exercise. Now, with that said, just because you are managing your weight and diet and are exercising doesn't necessarily mean that you have eliminated that hereditary fat. And for a lot of people, that creates a great deal of frustration because their goal is, of course, to come off medication for the treatment of high cholesterol, but they have inherited a gene. And so they get cholesterol management with the help of medication, but they still have issues with high cholesterol. We're having technical difficulty again with our slides, guys. Give us just a moment. Here we go. The question was, is there a direct correlation between high cholesterol and high blood pressure? And of course, absolutely there is. And the result of that is as cholesterol builds up, it causes the narrowing of the arteries, which we've said several times. The more narrow the arteries, the harder the heart has to work to pump to get blood to the necessary areas of the body. That in turn increases the workload of the heart. That increased workload of the heart can lead to heart attacks, strokes, and enlargement of the heart itself. So, risk enhancers for heart attacks and strokes. As you'll notice on here, current high cholesterol, family history of heart attacks and strokes. Again, the whole point of listing these is to identify the fact that cholesterol, high cholesterol, is a risk factor for heart attacks and strokes. And that is recognized by the American Heart Association, along with these other conditions that are listed here. All right, so what are the risk factors for high blood pressure? Again, we have modifiable risk factors, which are those things that we have the ability to change. And then we have non-modifiable risk factors. Those are the things that we don't have control over, but put us at risk anyway. And again, the lack of physical activity is a modifiable risk factor. Unhealthy diet, one that's high in fat and high in sodium. Being overweight or obese, drinking too much alcohol, having sleep apnea. Now that's an interesting fact. Having sleep apnea, how would that affect your cholesterol level? Well, with sleep apnea, the person stops breathing. And when you stop breathing, you stop circulating oxygen. It's temporary, but that lack of circulation of oxygen creates a condition in which the blood is no longer moving to the areas that it needs to in the body and in the brain. And so with that lack of movement or sedentary movement, you have that buildup. And so high cholesterol in itself can be a problem with the high blood pressure. If you're not moving blood or circulating blood, that means the heart has to work harder to make that happen. And so having sleep apnea, which is the lack of transportation of oxygen, and oxygen is carried through the red blood cells, creates an issue for the heart to have to work harder. I'm hoping that makes sense to everybody. And then, of course, having high cholesterol or high blood fat contributes to high blood pressure. Having diabetes is a precursor. Have you ever wondered why an individual who is diagnosed with diabetes is generally put on medication for their blood pressure and their cholesterol at the same time? That is because controlling the three of those helps to prevent cardiovascular events. If you have high blood pressure, high cholesterol, and high blood sugars, that again, that's that triple threat we talked about. And so the management of diabetes, cholesterol, and blood pressure sometimes takes medication to assist that person. I was one of those people. I'm a type 1 diabetic, but the minute I hit age 50, my doctor put me on cholesterol medication and blood pressure medication, even though my numbers were not significantly elevated. And I asked the question, why? Why am I being put on these medicines if I'm borderline high cholesterol or borderline hypertensive? And he just looked me in the face and said, it's to prevent you from having a heart attack or a stroke, because the combination of those three is deadly. And I was quite interested in learning more about that, but agreeable. And as I studied more, I understood the effects that each of those conditions had on the cardiovascular system. Smoking and tobacco use. It's not just the tobacco itself, it's the element in the tobacco when it's burned or when it's ingested. So it's not just smoking, it's dipping, it's chewing, it's the intake of tobacco itself and the release of that acrolein that causes problems for us. And of course, remaining in stressful environments. Stress can do a number on the human body. It can cause over release of cortisol. It can cause elevations in the blood sugar. It can cause elevation in the blood pressure. And all of those things can lead to cardiovascular events. And the things that contribute to high blood pressure that we have no control over, again, our family history, our age, our gender. Up until about 10 years ago, there were more men that had cardiovascular events than women. And that has now changed. We are now seeing more women than men having heart attacks and strokes. And of course, having certain diseases, such as chronic kidney disease, puts you at risk for high blood pressure. So when we talk about the damage that's caused by high blood pressure, again, this relates to the condition of having high cholesterol and the impact that high cholesterol has on the body. So a heart attack, of course, is when the plaque, of course, caused by this cholesterol builds up in the bloodstream and blocks the flow of blood to the muscles in the heart itself and in the ventricles. A heart failure is the increased workload from the heart for high pressure that causes the heart to get larger and fails to supply the blood to the body. So one is a contributing factor to the other. High blood pressure damages the tunica of the interim. High cholesterol forms plaque in the arteries. And then that plaque buildup causing a blockage leads to the heart attack. So by eliminating the high cholesterol, we don't have the plaque buildup that leads to the narrowing of those blood vessels. And so that's the correlation between having high blood pressure and having high cholesterol. So when we talk about strokes for just a second, I think it's important that we identify this because, again, having high cholesterol puts you at risk for heart attacks and strokes. And so knowing the signs of a stroke are very important. And we use an acronym, FACE. F standing for looking for an asymmetry in the face. Look for an uneven smile. A stands for arm. Check to see if there's weakness in the arm on one side or the other. S stands for speech, which means listening for slurred speech. And T stands for time. We need to call 911 the minute signs or symptoms are identified. The sooner you do that, the sooner that individual can be treated and prevent serious damage. Okay, so knowing that an individual can have high cholesterol, which can lead to strokes, it's important you understand what the symptoms of a stroke look like. So, treatment to reduce cholesterol. I think we kind of beat the dead horse, if you will, but it's important that you understand lifestyle changes are necessary. We can't expect our cholesterol level, our blood pressure, or our blood sugars to change if we do nothing. We have to change our lifestyles. We have to eat healthy. We have to exercise. We have to attempt to make weight loss occur. We have to stop smoking. They are the major contributors to elevations in our cholesterol. So, what should a person with high blood cholesterol eat? Well, recommended foods are foods that have omega-3 fatty acids. That's salmon and fatty fish. You want high fiber foods, such as roughage, green leafy vegetables, raw vegetables, fresh fruits. And those foods that the fruits that you can eat the skin on are going to be those that are best for you. And I've had people to ask me about certain foods. And they say, what about bananas? Well, do we eat the skin on a banana? No. So a banana is okay. It adds potassium, vitamin A, but it is not considered a high fiber food. High fiber foods include peaches, pears, plums, apples, apricots, those fruits that we eat the skin on. Berries are very important. Oils, olive oil, avocado oil, grapeseed oil, sapphire flower oil. Those are all healthy oils for us. That includes sesame seed oil as well. When we talk about seasoning our foods, onion, garlic, apple cider vinegar, those are all better for us than adding salt. Salts contribute to high cholesterol as well. We want to avoid refined sugar and grain products, packaged foods, processed foods, restaurant foods, foods that have hydrogenated fats or trans fats. And one of the ways to tell if a fat is hydrogenated or trans fat,
Yes, ma'am.
and a trans fat is basically a chemically altered animal fat.
Yes, they're in one
Hydrogenated
piece.
fats are those fats that are solid at
Okay.
room.
No, we have small little cans of soda also.
Crisco, stick
There's
butter. And everybody's probably going, what?
Oh.
No butter? We want butter that has some of the good oils or the unsaturated oils added to it. Meaning if you're using butter,
50 cents.
spreadable or sprayable butter.
You said Big Red, right?
is better for you. Because in order to make those soft,
No, it's just enough, right?
they have other oils added.
You're
like
welcome.
Canola oil, olive oil, avocado oil. And so if you're consuming butter with those oils in it are going to be better for you than stick butter. Because stick butter is pure animal fat. When we want to talk about other things to avoid, we want
You're
to
welcome.
avoid conventional dairy products. For the most part, an adult shouldn't be drinking whole milk. Our body doesn't require that much fat. We should be drinking 1% or skim milk or almond milk. There are other milks now that don't contain the amount of fat. And again, fat contributes to the cholesterol. And we want to avoid high content of caffeine and high alcohol consumption. So, some of the common oils, I'm not going to go through this whole thing for you, but I will just kind of summarize. The type of fat that is best for us is to help us with our cholesterol are polyunsaturated fats, such as omega-6 liquids, omega-3 liquids, and monounsaturated fats. Again, olive oil, olives, canola oil, nuts, such as almonds, pistachios, walnuts, and we want avocados and some seafood. Now, the thing about seafood can be very high in cholesterol, but very low in fat. I know that sounds contradictory, but such foods as shrimp, lobster, crabs, crawfish, clams, oysters, and mussels. They are high in cholesterol, but low in fat. And so we need to limit our shellfish consumption. There's a difference between shellfish and seafood, believe it or not. If we are consuming shellfish, that part of our diet should be consumed about once every 2 weeks. We cannot be Bubba Gump. We can't have the, fried shrimp, the barbecue shrimp, the shish shrimp kebabs every day. Shrimp, crab, lobsters, crawfish. If you're having one of those, you should have it no more than once every 2 weeks because of the cholesterol content. Okay. Exercise. Here it says 30 minutes a day for health, 60 minutes most days for weight loss and the improvement of your cholesterol. We already kind of mentioned that. 60 minutes a day for 5 days a week will help to improve your cholesterol level. And it really doesn't matter what kind of exercise you're doing. It's a matter of doing the exercise, triggering the muscles in the body to burn sugars and to burn fats. And to do that, we have to have an elevation in our resting heart rate. So if you say, well, I walk for exercise, and you're meandering and taking this slow walk, you're not elevating the heart rate, and therefore you're not getting the benefit of lowering the blood sugars or lowering the cholesterol. But if you're taking a brisk walk, that causes the body to trigger muscle activation to burn sugars and fat. And that can even be done from a chair. It's not what kind of exercise you're doing. It's that you're doing it consistently for a period of about 60 minutes a day. So again, smoking. I know I've mentioned this a whole lot, but it's important. Smoking can cause all kinds of problems. Cigarette smoke harms nearly every organ of the body. And it causes some disease, especially lung cancer. I'll tell you guys very honestly, both of my parents died from lung cancer, and both of them were smokers. And one of the most horrible things to ever watch is someone to die of metastasized lung cancer to the brain. That was my dad. He started smoking at the age of 12. He worked in the tobacco fields of Kentucky and smoked his whole life. And so if I can't impress upon anyone to do anything, if you want to maintain a healthy lifestyle, stop smoking. Estimates show that smoking increases your risk for cardiovascular disease or coronary artery disease by 2 to 4 times. But for strokes as well, 2 to 4 times. Cigarettes contain a host of toxins. So does vaping, including particularly the chemical compound called the acrolein. Acrolein, again, is a yellow, foul-smelling vapor that is produced by burning tobacco. It is also poisonous and is used in pesticides and chemical weapons. Scientists believe acrolein contributes to heart disease by affecting the way the body metabolizes cholesterol. Isn't that interesting? It's important that if you are having issues with your cholesterol, that you're following up with your primary care physician. Knowing the status of your cholesterol and level is important. One, if you don't know you have a problem, you don't know how to fix it. And so your primary care provider will be the main person to help you manage your cholesterol. Your primary care provider can recommend regular monitoring of your cholesterol levels, starting at age 35 for men and 45 for women, or younger if you're at a high-risk population. Children who have family histories of high cholesterol or familial hypercholesterolemia, which is a genetic disorder, should be screened as recommended by the pediatrician. Okay. So these are some of the resources that are available to you that help you in understanding your cholesterol, help you manage your cholesterol, and help you in the prevention of cardiovascular disease. I thank you for your time and your attention. And now I'll address any questions that we may not have answered in the presentation itself.
Okay, so one of the other questions, we have several questions actually.
Okay.
One question is, what's non-HDL cholesterol?
Non-HDL cholesterol is actually part of the dietary cholesterol that the body sees as bad cholesterol, but it is not necessarily part of the LDL. I know that's probably sounding confusing. The HDL components of the cholesterol, our good cholesterol, aid in the reduction of the bad cholesterol. But there are cholesterols that don't do either. And those are innate in the human body. Again, the human body makes all the cholesterol that we need. And that cholesterol that the body needs is neutral, if you will. It's not considered high density nor low density. It's kind of in the middle. And they call that non-HDL cholesterol. I'm hoping that helps to answer the question.
One of the other questions is, when reading a nutrition label, how can we decipher whether it's good or bad cholesterol?
Oh, that's a very good question. One of the things that you want to look at in the food labels, the first thing you look at in a food label on anything that you're evaluating is the serving size and the number of servings in the container. Because the information below that refers to one serving. And when we're talking about cholesterol, we want to keep those cholesterol levels low. And so for an individual, the cholesterol, I'm trying to remember exact numbers because we have that in our nutrition class. But cholesterol amounts should be less than 200. And so the cholesterol that you take in, you want to try and keep the HDL high, which is somewhere around 60. So that's where we're looking at, you know, the amount of cholesterol that we take in on a daily basis. Now, the thing with diet, a lot of people don't realize that as Americans, we should all eat like we have chronic disease. What I mean by that is we eat based on the assumptions that we have certain disease processes. And so our diet should be low carb, low fat, high fiber, high protein, and low sodium. That is the way that a person with high blood pressure is directed to eat. That is the way a person with diabetes is directed to eat. That is the way a person with high cholesterol, high blood pressure, high blood sugar, overweight, obesity, individuals with heart conditions, all of those individuals are directed to eat in that manner. The biggest issue is learning to read the food labels and knowing what to consume. And if you know those limitations, then you have the ability to select foods without someone telling you, eat this, don't eat this, eat this much of this, don't eat over this amount. And so if we learn that little mantra, low carb, low fat, high fiber, high protein, low sodium, then you as the individual have the opportunity to make appropriate selections based on your culture, your dentation, your likes, your dislikes, and you have the ability to make selection. Because the hardest part of any dietary lifestyle change is boredom. If you were told that you could only have one scrambled egg, one slice of turkey bacon, no bread, and a cup of coffee for breakfast every morning for the rest of your life, that would probably last about 3 days. And by day 4, you're going, the heck with this. I need something else. And so learning the mantra of what low carb, low fat, high fiber, high protein, and low sodium are, you then have the ability to choose certain foods. And you have the ability to make the evaluation on what is your medicine for your body and what is your poison.
Okay, one of the other questions is, how can you go about keeping your LDL down, but need to take iron due to low mean corpuscular hemoglobin concentration?
Now, that is a question that I can't answer. That is definitely a question that would be directed to a physician or a licensed dietitian. I am neither. So the only recommendations that I could make would be lean sources of protein and increased fiber. But then again, I'm sure there's going to be more to it than just that. By the way, in helping individuals to decide what lean proteins are, I teach people in my nutrition class this little saying: the less the feet, the better the meat. And then you're going, what? How many feet does a cow or a pig have? 4. What about a chicken or a turkey? 2. What about a fish? None. What about an egg? None. Mushrooms, edamame, tofu, nopalitos. All of these are plant-based proteins that I just mentioned. But when you're making selections of protein sources that are going to be lower in fat, which in turn lower in cholesterol, the less the feet, the better the meat.
One of the other questions is, can I continue to eat plain low-fat Greek yogurt?
Yes, plain low-fat Greek yogurt is very good for you.
The next question, looks like the last question, is their cholesterol is fine, but the LDL and non-HDL were not. Do they just need to continue the healthy eating and exercise, or why were those bad when my cholesterol was okay?
Again, a lot of it is, do I need to repeat the question, or can they hear? They can't hear you.
They can hear me.
Okay, good. All right, so a lot of that, if the triglycerides are good and the HDL was good, she said?
Non-HDL were okay.
Non-HDL was okay.
Yeah, the LDL and non-HDL were, cholesterol was fine, but the LDL and non-HDL were not.
Okay, the non-HDL has to do with the production of cholesterol by the liver. And the LDL, of course, is your consumption of fats and digestions of protein. And so dietary changes for leaner proteins would be something that could help with that. The other is, again, monitoring that non-HDL, because again, that's what's being produced by the body. And the rest of the cholesterol is what we consume. And so if the non-HDL is elevated, that could indicate there may be something going on with the liver itself.
Okay, are there any other questions? Okay, we're going to conclude the presentation, and I do appreciate everyone joining and asking a lot of great questions. Thank you for participating. Thank you very much. You guys, everyone have a great day.
Did you have any questions?
No, it's not really good information.